Etiology of facial asymmetry. Congenital developmental acquired. Cleft lip and palate cause unknown temporomandibular joint. Ankylosis. Tessier craniofacial cleft facial trauma. Hemifacial microsomia childhood radiotherapy. Neurofibromatosis Fibrous dysplasia. Torticollis Other facial tumors. Craniosynostosis Unilateral condylar. Hyperplasia. Vascular disorders Romberg's disease. Others. Facial asymmetry is common in humans. Significant. Facial asymmetry causes both functional as well as aesthetic problems. When patients complain of facial asymmetry, the underlying cause should be investigated. The etiology includes congenital disorders, acquired diseases, and traumatic and developmental deformities. The causes of many cases of developmental facial asymmetry are indistinct. Assessment of facial asymmetry consists of a patient history, physical examination, and medical imaging. Medical imaging is helpful for objective diagnosis and measurement of the asymmetry, as well as for treatment planning. Components of soft tissue. Dental and skeletal differences contributing to facial asymmetry are evaluated. Frequently dental malocclusion, canting of the occlusal level and midline shift are found. Management of facial asymmetry first aims at correcting the underlying disorder. Orthodontic surgery is performed for the treatment of facial asymmetry, combined with dental occlusal problems. Asymmetrical facial midline, harmonious facial profile and dental occlusion are obtained from treatment. Additional surgical procedures may be required to increase or reduce the volume of skeletal and soft tissue components on both sides to achieve better symmetry. Changkung Med J 2011 34 to 341-51. Etiology of facial asymmetry. Facial asymmetry may be associated with class I occlusion, but is more frequently associated with class 2 and 3 occlusions. In some instances the asymmetry is secondary to condylar hyperplasia or hypoplasia, ankylosis of the temporomandibular joint, displaced condylar fractures, or hemifacial microsomia. The etiology of facial asymmetry for many other cases is, however, still unknown. Facial asymmetry can be summarized and divided into three main categories: 1. Congenital, originating prenatally. 2. Developmental, arising during growth with inconspicuous etiology, and 3. Acquired, resulting from injury or disease, as shown in the Table 1. 810, Kawamoto et al. Divided the causes of an idiopathic laterally deviated mandible into two categories. 11. The first group involves alteration of the cranial base and glenoid fossa, which leads to displacement of the mandible. This includes muscular torticollis, unilateral coronal craniosynostosis and deformational plagiocephaly. 12-15. The second category involves condylar anomalies which result in hypoplastic or hyperplastic growth of the condyle. Examples include condylar fracture, condylar hyperplasia, and condylar arthritis and hemifacial microsomia. 16-17. The developmental type of facial asymmetry is idiopathic and non-syndromic in nature, and is not uncommonly seen in the general population. The asymmetry is not observed at birth or in infancy, and appears gradually, usually becoming apparent in the teenage years. There is no obvious history of facial trauma or detectable disease causing the asymmetry. One possible source is habitual chewing on one side, which is responsible for increased skeletal development on the ipsilateral side. 18. Persistent sleep on one side may be another cause. Haraguchi et al. Suggested that the etiology of facial asymmetry can be divided between those with genetic origins and those with environmental origins. 19. Neurofibromatosis is one cause of facial asymmetry caused by genetic factors. It is also noted that in cleft lip and palate, the pathology more often occurs on the left side, and this phenomenon probably has a genetic basis. 20. Intrauterine pressure on the fetus head, as well as pressure in the birth canal during parturition, can cause molding of the skull bones and facial bones, causing observable craniofacial asymmetry. However, this problem is usually transient, and the skull and facial bones return to their normal shape within a few weeks to few months. Non-hereditary conditions that cause facial asymmetry include osteochondroma of the mandibular condyle, which may affect the form and function of the temporomandibular joint, which in turn causes mandibular deviation and facial asymmetry. 21-24. Trauma, arthritis and infection within the temporomandibular joint can lead to ankylosis of the joint. 25. In a growing child, this condition can lead to unilateral mandibular underdevelopment on the affected side. 26. Cohen used the term hemiasymmetries in discussion of craniofacial asymmetry. He further classified these conditions into hemihyperplasia, hemihypoplasia, hemiatrophy and other miscellaneous entities. 27.